Good morning. Let's restart. How are you? Good. Full up? Excellent. I'm a bit of a part-timer today. I went and showed up late. You know, you're all women in the room, so my husband is working this weekend, and I have 3 kids at home. And of course, when we planned this date, my husband wasn't working this weekend, and Danny was. And so it was one of those mornings to get here, let alone get here on time. So, good morning. I am Michelle. It is lovely to have you here. Lovely to have so many new faces and old faces. So I hope you've made friends and got more acquainted with old friends. So we're going to kick off. I'm going to read out 2 quick bios so that you know who our experts are, and then we'll just run through our questions. Is that okay? Don't forget, there is a comfort break scheduled in the middle. So if in the next 15 minutes you're thinking, should I went to the toilet? If you can hold off, great, but if not, feel free. We're not going to tie you to your seat, don't worry, okay? So, Claire, our beautiful lady over here, is a mum of 4 lovely kids. Beth, who is 15, Will, who is 13, Joshua, who is 9, and Theo is 7, and is married to Simon, who is patient and long-suffering. She is a GP in Portadown and has other roles working within medical schools. So she leads worship in Beersbridge Elim and facilitates their choir. She enjoys baking and running, though mainly runs just so that she can eat her bakes. Working as a GP, though incredibly demanding, I'm sure, and stressful, it gives a unique and privileged opportunity to partner with women, supporting their health and their well-being. So life is exceptionally busy for this lovely mum, and she has many plates spinning, but she counts her roles as a privilege to serve God in the places He has her. And we are so blessed that she has taken up all of that time to come and be with us this morning as well. So Jen, our lovely lady on the right, left for you, is a proud mum to 4 teenage boys. So Dylan is 18 and Ollie is 16, alongside her stepsons, Jonah, who's 18, and Daffy is 16. So she spends much of her time embracing the beautiful chaos of family life, endless food shopping, and wondering how there can possibly be no clean towels left again. She deeply values joy and laughter and shared moments that hold everything together through ups and downs. A self-confessed foodie, she loves cooking meals big enough to feed the whole street and believes the best conversations often happen around a busy table. Although she trains at Oxford, she would say her most shaping education has come through her walk of faith, family life, and the privilege of being alongside people in real-life struggles. With over 20 years' experience as a consultant clinical psychologist across the NHS and independent services, she is deeply committed to supporting women navigating some of life's hardest seasons with compassion, hope, and honesty. She currently works in a private practice in Wales and as an associate with the Chelsea Psychology Clinic, providing therapy, supervision, neurodiversity assessments, and medico-legal work both locally and internationally online. And yes, Jen has flown in from Wales for this, so we are very appreciative for that as well. So if it's okay, we'll run through the questions, but we're going to keep it pretty informal this morning. Is that all right? We're just going to be a whole bunch of girls in a room over a cuppa. Is that all right? Super. Okay, right. So, Claire, let's swing off with you first. This one's like the one I'm here for, right? How to navigate life with teens and manage their periods.
I thought that was a great question, and I think the first thing to say is to accept that there is a huge variation of what is normal, and maybe just get, what do we say? I should have the clicker thingy. So yeah, there's a huge variation in what is normal. Thought it would be helpful to mention what counts as delayed puberty and what counts as early puberty. So again, there's a huge variation of normal, but if there's any signs of puberty before the age of 8, in girls, we would count that as early. It's probably actually a wee bit later amongst sort of white Caucasian. Earlier puberty signs tend to be more common in other ethnicities. So, and most people would be pretty like, ooh, if there's signs of puberty early, and they're quick to kind of come see us. What qualifies as late? again, there's a huge variation, as you probably know. But if there are no signs of puberty in terms of those, breast development, hair development before the ages of 13, you would count that as late. And if there's no sign of a first period by the age of 15, you would count that as late. So we would be keen to see kids in either side there. Irregular cycles are very, very common in the first couple of years, really, and you might not see cycles settle down well for anything up to 2 years. And again, that's normal. One thing I would say is teens don't know what a heavy period actually is, because they've nothing on which to compare. So you can occasionally get teenagers presenting very, very anemic, because they haven't really known that they're having torrential periods. So that, it's not massively common now. Most mums are pretty switched on, but they don't really know what's normal. And there's a lot of reassurance needs to come around it. I would be a big advocate of, whenever my daughter had her first period, she came home and I cried and she had almost fainted, and it was all a wee bit dramatic. And then an hour and a half later, I was like, right, out on the paddleboard. And she was going back out paddleboarding. And I thought that was an amazing kind of opportunity to say, do you know what? But life goes on. And let's do life. This is part of life. And it really helped her to normalize, The other thing which, to mention painful periods, they tend not to be as painful in the first couple of years, similar to how older ladies' periods are often not as painful, and that can be because they're not actually ovulating. But when the pain kicks in, and it can, and lots of you women will be well aware of that, the most effective pain relief for teenager for that pain is ibuprofen, rather than paracetamol. So unless you have any reasons why you can't take ibuprofen, but most young people, unless they're very brittle asthmatics, can take it. So ibuprofen rather than paracetamol for pain. And can I commend to you period pants for young girls? They are an absolute game changer, great for the environment, and save you all the pads and all of that. So period pants are brilliant. There's some really great brands, and we have found those, just a wee practical suggestion as a mum rather than anything medical. And the other thing is, if they are really running into real problems with a lot of pain, going to bed with pain and missing time from school, if they're young enough to have periods, they're young enough to manage the periods. And if they're young enough to have periods, even if they're only 13 and they're having terrible bleeding and terrible pain, then the options which we use for older ladies are fine to use. And if that means, it's not very common that we have to put very young girls on the pill, but occasionally it does happen. So don't be afraid of that as such. We do not want 13 and 14-year-olds losing lots of time from school. So I would be fairly, try and deal with it fairly proactively. So hopefully that's a wee bit of an overview.
Yeah, no, that is absolutely brilliant. Thank you so much. And Briffin, that's a good tip, actually.
Ibuprofen,
Yeah, great. Thank you.
Ibuprofen, Brufen, Nurofen, whatever it happens to be, yeah.
Super. Excellent. Thank you. So Jen, completely different. Complete different question entirely. But what are some of the most common mental health challenges us as women would face today?
Thanks so much for having me. I'm just so glad to be here. I just want to say that. I think what makes women's mental health, really complex is that we're sort of navigating a lot of very unique biological, psychological, and social pressures all at once. If you think about our biology and the hormonal changes throughout our lifespan, it's incredible. Just, the impact of that on our mood, how we can regulate our, feelings, memory, etc., etc. And I think psychologically and socially, there's a lot of pressure, I suppose, just on women to feel more emotionally attuned and to care, I think, for other people. And often I do see that, women become very skilled at holding things together, whereas inside they could really be struggling. And I would see we would call it quite a lot of internalizing difficulties, where it's not overtly obvious, because let's be honest, all of us cope very well on the surface, and we have like, this kind of very good front, but inside we might be struggling. So I would see a lot of, say, things like anxiety and depression, which, I think women over their lifetime experience twice as much, actually, than men. So it's quite a huge figure. But actually in my clinical work, there's 4 challenges that I thought I'd talk about today that I would see time and time again, coming up a lot of. And the first one is what psychologists would call an invisible mental load. And just to illustrate this, if you feel really comfortable, that is, just to stand up if you've ever felt pressure to be everything to everyone. I mean, I'm going to stand. Quickly stand. And stay standing. I mean, stay standing if you've, or stand up if you've ever felt guilty for having a rest. And stay standing or stand if you've ever felt not enough, or I'm a bit too much, like you feel a bit like a burden. Okay, so if you can sort of have a look, it's nearly all of us. So it can often feel like a really personal experience, like you're not coping, but actually, in reality, it's a very shared experience. So I just wanted to, you can sit down now. Because I think many of us are managing so many responsibilities. We've got careers, we've got family life, we've got friendships, we've got, parenting as well. And I think the mental load is all that invisible stuff in the background. It's remembering to send that email to book a GP appointment. It's, buying the uniforms. It's remembering the toothpaste is going to run out. It's birthdays. It's social things. And that over time, I think, adds up. It can be impossible to switch off. The second one I would see a lot of is perfectionism. And by that I mean, women tend to be their world's worst critics. And I think there's a lot of, the self-talk is really harsh. I mean, I would see a lot of women who are so capable and amazingly successful, but they just talk to themselves in a really harsh way. And I think, to be honest, I think we're all guilty of that. So that kind of looks like I should be doing more. I'm not coping, very well. So, and it's not just about high standards. I think it's more about feeling worthy or feeling accepted or enough. And I think when we understand it like that, when people say, oh, just lower your bar, it's fine. I think it's really hard to do that because it's not connected to performance. It's just so interlinked with our identities. So the third thing I would see a lot of is comparison and social pressure. And I think for younger women especially, I think they've got a lot worse than, say, my generation. There's so many things, in social media that people are subjected to, just these lovely, beautiful homes or amazing bodies that we're meant to have, or thriving children, or effortless relationships, and that's really hard. And I don't think it's about, well, she's doing better than me. I think it's often, comes across like I'm not enough as I am. So I would hear a lot of that in therapy. And so even people who are doing really well, I think often can feel like they're failing, because the goalposts are just constantly shifting and moving. And the last one I would see a lot of would be just compassion fatigue or just emotional burnout, where you just feel absolutely exhausted. And I just want to play you a quick clip, which is a funny clip. She's an American comedian, just to illustrate this.
Till I can get through Christmas. And I don't mean to sound like everything falls on me, but everything falls on me. I love my family, but they don't do anything to help me. I do all the decorating, the cooking, the cleaning, the wrapping, the shopping, all that. Last year, on December the 24th, my husband said to me, "Can I help you do anything?" And I said, "I'm going to beat you to death."
So that, sort of illustrates a little bit. of what we kind of know. We are literally the glue, and I do think that we should celebrate that. Let's be honest, it's a really lovely, amazing quality in all of us, but it can often leave us feeling really depleted, and I'm guilty of this as well. I find it hard to ask for help. I find it hard to notice, even whenever I've taken on a bit too much. So I think it does lead to exhaustion over time and just, like a slow disconnection from ourselves. So I think if we are to understand that mental health issues are not just a personal failure, I think they're understandable in a context, a wider context of the pressures that we're under. Sometimes unrealistic expectations outside of us, but also internalized ones that we place on ourselves. Emotional overload, and also environments that kind of cause us to just keep carrying on without any rest. But what we know is that mental health improves really significantly if we're more compassionate, sort of less critical with ourselves. We have better boundaries, which I'll talk a little bit more about later, and more shared responsibility. And environments that we create where we don't have to have any rest just because we're absolutely exhausted. And I think, that benefits and ripples out, just not just as us as individuals, but in our families, in our home life, in our work lives, and in our wider sort of communities.
Brilliant.
That was a very long answer.
No. I dare say everybody in the room could fit into one of those categories somewhere, shouldn't we? And knowing how your mental health is impacted by just those little things every day really does help to help us change that, in the future. Claire, have you any advice for women who have just had a baby? And I suppose if you're well past baby stage, still you'll have daughters or friends who might still be in this stage that you can support in this way then after. So I think it's an essential question for us all as a village, isn't it?
Yeah, no, absolutely. I know we're not supposed to ask for one-to-one sessions, but I think I need about 6 sessions with Jen. Anyone else? The postpartum period is a wonderful blur, but also one of the most grueling experiences of a woman's life, actually. And whether you're balancing breastfeeding or toddlers or other children and so on, it's absolutely grueling. And women's health is either at its very best in that time frame or potentially at its very worst. Some of the physical bits and pieces I thought it would be helpful to chat about. The breastfeeding I do have a particular interest in, I would commend that to you to support, even if you're not the mum, to support those around you actually with that. Women's ability to breastfeed, our breastfeeding rates here in Northern Ireland are sadly some of the worst in Europe. That's probably because our support is not just what it could be, and culturally it's been difficult to embed, but certainly I encountered some of the most grueling times of my life whilst trying to breastfeed each of my 4 babies, but probably what kept me going was the peer support that I had around me and friends and family who had also breastfed through all the difficulties and the challenges. Contraception, if you're not breastfeeding, and even if you are, you need to consider contraception from as early as day 21 after having had a baby, okay? So just something to keep on your radar, and there's some good resources, contraceptive choices after having a baby, if you it's in the actual leaflet. So you need to think about that, and pregnancies which come very quickly together, unless that's how you plan it, can really increase the emotional and the difficulties associated, and even just the challenges on the body. And if you have a cesarean section, it's best to space at least 2 years between having babies. So think about your contraception. For some women, it's like the last thing on their mind, but you don't want to get pregnant unexpectedly, and then that be a challenge. Bleeding's very variable after having a baby, but obviously pain, clots, any sort of bad odor, anything like that does need checked out. We don't usually do smears any earlier than 12 weeks postpartum, and you just stay in your normal recall. So smears start age 25, and then they're every 3 years for women up to age 60. Exercise, a lot of people ask about this, and there was this kind of historical thing, oh, you wait for 6 weeks. I think listen to your body, and if, we would encourage pelvic floor exercises particularly. It's not necessarily, whenever I see women who've had babies in around the 8-week mark when we're vaccinating their babies for the first, it's not usually then that they have the problems. It's many years later. And so implementing pelvic floor exercises early in life and getting into structure and routine of doing this. Are we all doing them now? Yes. Is really vital and really, really important. So doing your pelvic floor exercises straight after you have a baby is absolutely a good idea, and then gradually building on that. Obviously, if you've had a cesarean section or a complicated tear, exercise probably should be a bit delayed, but you will know once you start to walk, if you feel well, it's okay to walk. If you're feeling a bit achy and sore after a walk, maybe just done a wee bit too much today. So listen to your body. Don't put a lot of pressure on C-section wounds within the first 12 weeks. Perinatal mental health is a big area. There's a big variation here. If you have previous mental health difficulties, you're much more likely to have difficulties in the postpartum period. We do now have perinatal mental health teams, and if you have current mental health struggles and you're pregnant, you should be referred routinely to the perinatal mental health team, and there's really good support there. I've put on this support. It's absolutely vital. It really does take a village, and very often those very severe mental health problems, which are very rare, it has to be said, very severe mental health problems are rare. I'm talking about things like postpartum psychosis, which is terrible. Those are the things that other people are more likely to see, so you need other people near you and close. But the risk of that's only about 1 in 500 or 1 in 1,000. But it's very serious, and it tends to present within the first couple of weeks postpartum. Baby blues, as we all know and all experience, anything up to the first 14 days, really embroiled in sleep deprivation, overwhelm, hormonal change actually after having a baby. Postpartum depression, again, very common, and often tends to start to show early signs after those first few weeks. But most often we don't see women actually present until a little bit later, and in around the 3 to 4 month postpartum mark is where most people present with postnatal depression. It doesn't mean that the symptoms haven't been there for a bit longer, but that's generally when they come forward. And there is help and there is support available, and medication can be so helpful. And it's not all medication, of course, but it can be so helpful, and I would have a fairly low threshold for starting it if someone's presenting with postnatal depression. And if you're on medication, if you take medication for your mental health, something, say, like sertraline for anxiety, depression, don't stop it. If you become pregnant, don't stop it without speaking to somebody. And most of these medications are safe in early pregnancy, and a mum becoming unwell mentally is more of a risk than the medication itself. So, that's a wee bit about the postpartum.
Brilliant. I do want to say here, based on what Clara has just said about support, if you happen to be someone who doesn't have support for whatever reason in your life, please know we're here for anything at all, be that postpartum or anything else. We firmly believe we should journey life together, and not just religiously, just in every capacity. So if you don't have someone in your corner fighting with you for stuff, please let us know, because we would love to be that person for you. Jen, we often hear the words stress and trauma used interchangeably, but how are they actually different, and how does that look in healing?
Yeah, I mean, I don't know about you, but I've heard quite a lot recently just about people using the words, like, oh, I'm really traumatized about X, Y, and Z, but actually they're talking about stress, or vice versa. So I just think the two are the two are very different, and they live in the mind and the body very differently. I mean, all of us here will have experienced stress, I'm imagining. And it looks very different. What stresses me out might not stress you out. So it's such an individual thing. But what is it? I mean, it happens really whenever the demands on us feel greater than our ability to cope in that moment. So it's kind of like the accumulation of responsibilities without enough support or enough rest. And again, it's like carrying shopping bags, to the car. If the car is parked, initially they're fine, but by the time you get there, they become heavier and heavier. There was actually one study that showed that women recovered far more slowly after stroke surgery, not because of their biology, but because they returned far more quickly to caregiving roles, to running the households, than prioritising their own recovery. So I think a lot of women's stress is almost chronic, I would say. It's not just occasional. So we kind of take that on and it kind of affects us very profoundly. So trauma is actually different. Trauma, the actual word means wound. And it occurs when something is so overwhelming that our nervous systems just can't really process it at the time. And as a result, I think, and some people in this room might have experienced quite traumatic events. I think it continues to live in our bodies long after the event. And that can look like panic. I don't know if you've seen someone having a panic attack. It's really quite scary. And it can feel for that person like they're literally going to die. It could lead to sort of maybe avoidance, or maybe someone being really hypervigilant, or just generally feeling really unsafe. I often describe the nervous system a bit like a smoke alarm. It's kind of designed to go off. It's adaptive whenever there's a fire. But usually after chronic stress or periods of really traumatic events, or something's happened to you that's really bad, I think it can just go off, when someone's burning the toast. So it kind of becomes super, super sensitive. I worked with a woman who basically suffered childhood sexual abuse, but she got recently married. She was in a loving, safe relationship, but she came to me because she was struggling with physical intimacy and just closeness, just emotional closeness as well. Not because she thought she was really unsafe, but just because her nervous system had learned that closeness equaled danger. And I think that's something really important about trauma, that it can teach us that the body continues responding to old danger whenever the present is actually quite safe. And we can sort of practice a little bit of that, about what I mean just now. This is a picture of a lemon. And I just want us to imagine we're holding a lemon, one of those big, lovely Spanish or Italian lemons that we've just picked off the tree, really citrusy. And what I want us to imagine is just taking a big, giant bite out of that lemon. I mean, I can sort of taste a little bit of it. I can sort of like go like that with the sourness. So our brains essentially have predicted that experience from past experiences. And our bodies have literally just responded accordingly. So that's a little bit, what similar to how a traumatic response would be. So it's a total non-conscious thing. But the good thing is that we can heal from both. Now that looks very different. So healing from stress, I think, is about restoring balance. And, how we do that is different for all of us. What things can we lay down? What things can we share with other people? How do we ask for help whenever we're overloaded? That's all about building boundaries and also creating recovery time. I mean, how many of us really, intentionally, pencil that in, meeting with a friend for a coffee, binge watching a series on Netflix that we like without guilt. So it looks very different, but I think it's super important to sort of actually prioritize that. Healing from trauma is a little bit different. Obviously, it takes a lot longer and it's a bit more complex. But essentially, it's about restoring safety in our bodies, safety in our relationships with people, and in the environments that we find ourselves in. The one thing, though, that unites both, I think, healing in connection, for humans is probably the most important thing, I think, for mental health today. And it's not just connection with others, which you would assume, but it's also connection with ourselves. If we're feeling overwhelmed, I would say the first thing to do, when someone's having racing thoughts or they feel, they're going to have a panic attack. They're in here, and I would just say, look, you need to go into your body first. And the best way to do that is by breathing. And we often forget that. It's so simple, but just take a breath. Humming, singing, also good just to regulate, what is your favorite song or hymn? It's just kind of finding ways just to regulate and be more present inside your body. Movement again, doesn't have to be going out for runs or to the gym, even just a stretch. It's actually, there's loads of research to show that movement is just as effective as medication and therapy, especially for trauma. So that's really interesting, just to remind ourselves about that. Some of my clients would literally ground themselves and take their socks and shoes off and go outside and stand in the garden for a minute just to sort of, center themselves again. And that's another really good, these are just strategies that, the list is endless, but they're just a few pointers. Listening to music, having a cold shower. There's lots of evidence about cold water swimming these days, but even just splashing some cold water on your face can help just lower your arousal. Having a warm bath, spending a few quiet moments. I did last week, just having a coffee in the sunlight and that being on my face was just really lovely. And all these really just inject oxytocin, which is basically our body's antidote to all the stress hormones like cortisol. So any of these strategies would be really useful, almost like an antidote in those moments when we feel really stressed or we feel overwhelmed. So what is really hopeful, I guess, is that yes, our bodies carry the stress and trauma, but we also carry the healing, the capacity to heal for that as well. So we have that, within our realm as well.
That's brilliant, isn't it?
Yeah.
And I suppose it fits for everybody. Everybody has a way of doing that. But if not, please see someone like Jen. But if you're finding it hard to do it on your own, there's no harm in taking help from outside as well. Isn't that it?
Yeah,
but of course, trying all of those things. I go outside with no shoes and socks on, and my husband's repulsed by it. I'm like, weirdo. Men, right? So, Claire, have you any thoughts on the links between physical and mental well-being? Oh, clicker. Sorry, I forgot.
I think yeah. So physical and health and emotional mental well-being are intrinsically linked. I think we all know that. They are two sides of the one coin, and there are definitely links between some chronic illnesses and some mental health difficulties. A good one that makes sense is chronic pain being linked to low mood and anxiety, but lots of chronic illnesses actually as well, because of the impact potentially that they have on your life. Obviously, poor sleep can impact your physical well-being. If you've poor sleep, your ability to cope is definitely less. We all know that. That's like common for us all. Our irritability will be higher. Our resilience just feels that bit lower. And often if people can get a few good nights sleep, things feel lighter and feel a bit better. There's really good evidence for the benefits of exercise for both physical and emotional well-being and mental well-being, like Jen said. And I'll speak a wee bit about that in a minute. Good diet and good nutrition. Let's not forget about that. Our nutrition is so important for our bodies at every stage of life, and we all know generally what a good healthy diet looks like. And plates that are full of colour are definitely better than plates that are all kind of beige. And we know, of course, as well that BMI, or body mass index, our weight relation to our height, is very highly linked to physical health problems. And there's a lot more cancers, cardiovascular disease, musculoskeletal problems. That really refers to your back pains and your knee pains and your ankle pains, foot pain, those sorts of things. Much more closely related to higher BMI, type 2 diabetes and hypertension. So loads and loads of health problems. The World Health Organization has said that up to, I think it was 70% of physical health problems were potentially preventable through lifestyle change and implementation of healthy lifestyle, and that's all things cardiovascular disease, type 2 diabetes and cancers. So it's huge statistics of things that are actually preventable through lifestyle interventions and healthy lifestyle, which I believe we should be promoting to our children and our young people as well for their futures. The other thing is, higher BMI is really linked to that sort of lower confidence, lower self-esteem. I see loads of that. People who are just unhappy with how they feel, and it's not about how you look. It's very little to do with that actually, and much more about your ability to move, your ability to get out and about, and maintenance of independence, particularly as we get older. The benefits of exercise are absolutely huge. I can't overemphasize this or overstate this enough. At every stage in life, the benefits of exercise, whether you're young, a child, teenager, but even in later life, exercise is all about promotion of independence and improving balance, improving muscle strength. So you don't have to be able to go out and run a race. And I think sometimes some of our older ladies I think for generations we've associated exercise with staying nice and trim. And that actually is, hopefully the mindset on that is changing a bit now. That is actually such a small part of it. It really is about improving bone, muscle strength, looking after our bodies well so that they work well and that they move well, and that we really promote independence as people get older, and improving muscle strength and balance is a huge part of fault reduction. So I'd really commend to all ages that we all do something. And like Jen mentioned as well, there is research there that suggests that regular exercise may be a more effective treatment for mild depression than antidepressant medication. It helps boost serotonin and dopamine in the brain, and it really improves self-esteem, confidence, and helps to relieve those symptoms of depression. I was one of those kids at school who was last in every race, picked last for everything. I was terrible, not naturally in me at all. I dragged myself over the finish line of the Lisburn Half Marathon last year. I'm not suggesting that everyone needs to do that. I started to exercise for physical health benefits, but also mental health benefits, and just being able to, and I could see the benefit of it for stress management. So I commend exercise. That's an article from the BMJ, the British Medical Journal, which was comparing exercise with medication and medication or exercise. It's not that medication doesn't have its place, it absolutely does have its place, and I prescribe lots of it for appropriate cases. But I have a lovely friend actually who wouldn't mind me sharing that she really started to struggle with anxiety, very crippling anxiety, very debilitating anxiety, and was on medication and did okay. But she is preaching from the rooftops the benefits of exercise. She said it was an absolute game changer. She thinks she did a triathlon or something there recently, but she says it was so much more effective than any medication that she took when she was able to get out and move her body. So hopefully that's a wee bit of an overview there.
It's brilliant. Isn't it great to see that mind and body connection in just so many of these questions? There's so many wee overlaps there, isn't there? It's great to see that. So Jen, why do the everyday challenges of parenting young children sometimes feel bigger than the situation itself?
Well, I think one of the very least talked about parts of parenting, especially young children, is you're not just raising a child, but I think you're often meeting parts of your childhood self again. I mean, most people expect parenting to be really physically exhausting, the sleep deprivation, the negotiations over everything, basically shoes, vegetables, bedtimes, whether the pasta's not touching the sausage or whatever that is. But I think what surprises many parents is that it's how emotionally exposing it actually feels, because suddenly really small moments become really gigantic. I just want to play you a clip that just illustrates this, really. I think some of you might have seen this before. So basically, it's not really about that moment. It's not about the crisps, is it? It's not about whatever that is. Something old is actually happening there. And so I think what we were brushing up against maybe is around other things of maybe it is perhaps the way that we were parented. And that might be, a fear of losing control or pressures to get things right or just being like a good parent. And I think lots of the attachment research does tell us that the way basically we were parented does affect how we as adults regulate ourselves, how we regulate our stress levels, our emotional regulation, and also how we do connection with other people. So it's really interesting. I think I grew up really compliant. I was good enough, had my moments, obviously. But I did what I was told, and in the main, I wanted to please, and also I knew what would happen if, I didn't do what I was told. But then I had my second child, Ollie, who was just literally woefully defiant. He just was horrendous. And I remember phoning my family, just going, I just don't know what to do, because I'd read the book, and obviously the books are, okay, but this is not what's happening here, I remember going out with him with like odd shoes on because he just point blank refused to wear, the same shoes or his pajamas on because he didn't want to wear clothes. But, secretly, in a way, yes, it was annoying, but I was secretly quite impressed, because I never grew up like that. I mean, I had learned that being lovable meant you were easy to manage and, you did what you were told and you were sort of good. So parenting just didn't challenge my patience. It sort of brought me back into my old beliefs about what it meant to be lovable or what it meant to be acceptable. Which is why, thank goodness, the goal is not perfect parenting. It's just about being good enough. So what does that mean, when people say that? I think it just means being responsive enough and, attuned enough, basically. And I think one of the most important things I think we can give kids is repair. And repair looks like after there's been an incident like that, coming back and saying, look, I wasn't my best, or I'm really sorry. But more than just I'm really sorry, I'm sorry because I know you shouted or, something happened. And then an intention, how you're going to do that differently next time. So it's a real sense of meeting the child with a real level of honesty about what you're going to do. So you're really modelling, this is how you do it. Let's try again. And I think that children don't learn really from never experiencing conflict. Of course, they'll see it. If it's not at home, they'll see it somewhere else. So I think it's about just teaching them, modelling that actually there's a way back. We can reconnect. This relationship is repairable. And I do think that transcends into adult relationships as well, where, often, sometimes I would feel if I've had an argument, oh, it's totally catastrophic. That's the end of everything. And it's not. It's repairable. So it's a really good lesson, I think. But equally, I think we get the opportunity to reparent ourselves, which again, I think is quite scary. But, even just saying in those moments, look, this is hard. I am really struggling. And another good question to say in a moment, even as, if it's not related to parenting, but if you're feeling emotional overwhelm, is what do I need? I'd often say to clients, just what do you need in that moment? So asking yourself that, A, it implies that we have needs in that moment that are, not being met. And B, it gives you a bit of time just to maybe relate to yourself differently. I'm not saying we'll have all the answers, but it's just little things to try and a tiny chink of time that we can use. So I think the research has shown really that parents become less parents, when we become less harsh, whether that is saying to ourselves, look, I'm okay, it's going to be okay, they become less reactive with their kids as well. So parenting doesn't just raise children, I think it raises us alongside.
So good. Well, that is the end of our session 1. So please do not hurry away. We are going to look in our next session at things like menopause in the next session and what that looks like for us to kind of manage and be prepared for. If you want to take about 15 minutes now to just go and take a comfort break, grab a bottle of water, stretch your legs, please do so, and we will see you back here then at 12 o'clock. Thank you so much. Thank you, ladies. Next numb. Yeah. Okay, so session 2. Here we go. Same again. So Claire, as women get older, we can struggle with low iron and B12 levels. So how would we best to manage it?
All right. So this B12 is very topical at the minute. There's lots of private providers out there giving like B12 infusions and things like that. I maybe say less about that and more about, what did I say? So significant B12 deficiency is where you do not absorb B12, okay, from your gut. It's a condition called pernicious anemia or autoimmune gastritis. And it's not hugely common, actually, but it presents with anemia because you need B12 to manufacture your red cells. There are certain risk factors for that. Family history, of course, of pernicious anemia. But I would say out of all of the B12 levels that I manage and all the blood results that I wade through and these borderline B12 results, there are not very many people with pernicious anemia. So that's where the challenge really lies. There are some things, so if you've got Crohn's disease or you've had some part of your gut resected, you're much more at risk of B12 deficiency. And the huge diversity of symptoms. I mean, there are hundreds of symptoms that could be related to B12. And the most tricky one is when people present with fatigue. That is one of the most common presenting complaints that I get is people feeling tired. But what are very definite symptoms of B12 deficiency, because fatigue and tiredness is so multifaceted. There are so many contributing factors, and I couldn't begin to tell you the number of times where we do a screen of bloods for somebody who's tired all the time and all the bloods are normal. So, you know, it's a very complicated area in many ways. It does need a good history and examination, a good drill down into all the physical things, but also the psychological, the mental load. You know, it's a big complaint in women, as you would well know, much more fatigue amongst women than in men. Sorry, I'm digressing. Back to B12. So the symptoms that are that I really switch on whenever I hear with regards to B12 is anything to do with pins and needles in the hands or the feet, a sore tongue, a tingly tongue, those symptoms, any kind of numbness, burning sensations, glossitis, that's a sore tongue. The sort of brain fog, memory problems, that's a wee bit more. So B12 would be done as part of a dementia screening set of bloods, just to make sure that, because it can affect your cognition, your thinking processes. But the sort of the fatigue and the generalized weakness can be caused by so many things as well. So whenever you look at a B12 level, you have to look at the whole picture. It's not just so much about an absolute number. So there's been a couple of things that have made it very challenging recently, and there's a huge variation in practice out there. Number one, the lab references changed. And so what previously would have been classified as a normal level is now classified as a borderline level. That has been a challenge. And the NICE guidelines from the National Institute of Clinical Excellence guidelines were updated with regards to B12, because historically there were loads and loads of people out there who were getting B12 injections every 3 months, who we now think probably don't necessarily need the injections. And may be able to be managed with oral replacement. There are dietary sources. We do see it in people maybe whose diet is not as varied, and so there are dietary sources which you can read there. It's all your animal-derived products, all your meats and fish and eggs and dairy and so on. Oral replacement can actually be bought over the counter. So you can actually get quite high dose of vitamin B12 over the counter. And I certainly have changed my practice a little bit in that if people don't have the anemia, they don't have the neurological symptoms of the tingling in their hands and their feet, I don't necessarily go straight for the injections, and we go more for oral, and then we reassess that, maybe looking and see, have the levels come up. It's a tricky area, and you maybe can sense that from what I've said. It's not an absolute, here's the level, here's the treatment. You do have to think much wider and deeper about that. And as I say, you'll find there's variation, and you may have low B12 and you're getting injections, and somebody else might have low B12 and they're getting a prescription for tablets, or you might have low B12 and you've been told by your GP to go and buy your tablets. So there's a massive variation in that. So iron deficiency then, that's definitely very different, although iron is needed to manufacture red cells. So with low B12 levels, you get a type of anemia, and with low iron, you also get a type of anemia. The result is a low hemoglobin, a low blood count, which causes all of the symptoms of fatigue and lethargy. Again, the symptoms of iron deficiency, fatigue is caused by so many things. But hair loss, thinning, itch, restless legs, that's a really interesting one. Anybody ever get restless legs? And it can be associated with low iron levels, so it's worthwhile thinking about that. And a lot of women in pregnancy get restless legs as well. It may be related. Also sore tongue, dizziness, shortness of breath, chest pain. That really refers to when your when your hemoglobin level has dropped and you are anemic, that you start to become short of breath going up the stairs. If you're an older person, you're more likely to get angina-type chest pain if you're very anemic. And hopefully most people are now presenting before they would get to that stage if they were anemic. In women, so the biggest cause is menstruation, is having periods. And if your periods are heavy, it's a really great marker actually of how heavy periods are. If your hemoglobin is dropping, it's time to do something, ladies. If you're anemic because of your periods, it's time to be thinking about a Mirena coil or some medication. There's a whole variety of treatment options that you can think of. So that's the most common. Malabsorption, this also will come across to your B12. B12 and folate are closely linked, as you've maybe heard, but B12, folate, ferritin deficiency. Anybody who's iron deficient, I'm always thinking of celiac disease as well. So if you haven't had a celiac profile checked, because very often it is put down to, particularly in women, you're 30, you're anemic, it's most likely your periods, and it most likely is. However, it's important to think laterally as well and think about celiac disease. I actually have a niece and a nephew, both with celiac disease. An interesting little niece, I'm sure they won't mind me sharing, presented with anemia and no other symptoms. So it's a really good one to think of. Blood loss from the gut. If I had an older lady or gent come into me, particularly an older lady, say in her 60s, who's suddenly become anemic, periods have stopped, that needs investigated. Okay, that we can put anemia down to periods when women are having heavy periods. However, if the periods have stopped or the periods are not heavy, we need to think about other causes of iron deficiency anemia. And blood loss from the gut is by far the biggest. So upper gut, so stomach, that usually presents with sort of, you could have symptoms of bad indigestion, like a bleeding ulcer or something like that, or the lower gut. And we need to think about investigating both the upper gut and the lower gut if somebody's presenting with a new iron deficiency anemia. Yeah, this would be one that I like. So if I have a lady complaining of feeling fatigue and her ferritin is low, that's your iron stores are low, under 50, even with a normal hemoglobin, because remember hemoglobin is manufactured, the red cells are manufactured and they need iron stores to do that. So even if the hemoglobin is normal, if the iron is low and the lady is complaining of fatigue, or the woman is complaining of fatigue, I often give them a course of iron to try and boost that and to try and improve that, and can certainly help with hair and skin and nails and restless legs and so on. Similarly, if I had somebody with a borderline low ferritin level, I'll give them some iron to see does it help their restless legs or does it help some of those other things. So quick whiz around B12 deficiency and iron deficiency.
Yeah, absolutely. But sometimes we look at those and go, oh, they're just vitamins. But they really do have such an impact on your body, don't they? But Claire, also, could you give us some advice on how to navigate the symptoms of menopause, even looking at the thoughts of hormonal and non-hormonal options or approaches that are available?
So this is really topical at the minute as well, isn't it? And I was mentioned at a women's health thing on Thursday night. The pendulum has swung massively, even in my career time, as to how menopause is managed. It's great that we have much more awareness around it, but we now have a lot more younger women coming forward as well. And just a couple of definitions. So menopause is defined as the time when you have not had a period for 12 months. The perimenopause really is when you're having some symptoms of the menopause, but you're still having periods. So just a couple of definitions. The symptoms are diverse and huge, and the very definite cardinal symptom of the menopause is the hot flushes and the sweats and the absence of the periods. But affects, lots of ladies complain of muscle aches and pains, joint aches and pains, poor sleep, vaginal dryness, irritation, insomnia I've mentioned, mental health difficulties, more anxiety. It's very interesting, actually, the link between the menopause and mental health. And I'm sure Jen will talk a wee bit more about this as well. But you have to remember that women who are coming into that stage of life, so the most common age for menopause in the UK is age 51. But anybody really after the age of 45 with menopausal symptoms, we wouldn't necessarily do a blood test for those. It's not recommended that you do, because if you're over 45, you're having symptoms of the menopause, we'll say you are perimenopausal or menopausal. So we do have still lots of ladies who'll come forward looking for the blood test for menopause, but again, it has to be part of the bigger picture of what are the symptoms, what age is the lady, and what way are the periods. So women in and around those sort of later 40s, early 50s are experiencing huge change, either in their family circumstances. Often kids are leaving home, they're starting to drive, they're parenting teenagers, they've still got very busy work lives, their parents are aging. And so all of those things increase anxiety, increase the stress, and so it's hard to know. You maybe heard the phrase correlation, causation. So what runs alongside and what is actually causative? And I don't think we can separate them. They're intrinsically linked. Brain fog, of course, again, that sort of cognitive difficulty. Can't remember things. I mean, I definitely cannot remember things the way that I could whenever I was a teenager and a young person, which is my big mantra. That's when they need to learn scripture, when they're teenagers and young people, because they've got great memories for it. And we don't have the same memory as we get older. But again, is that because women carry such a huge mental load, and there's so many tabs open in our brains and we can't get them closed down, that's why we've got the brain fog. So plus the sort of dip in the estrogen levels. So it's very intrinsically linked. There are things that you can do to help yourself, and all of those lifestyle things. I'm not going to go through them all again. We all know them. Get outdoors, get your vitamin D, good nutrition, plenty of exercise, and stop smoking, don't drink alcohol, all of those things. Reduce down spicy foods and caffeine, reducing hot flushes, managing stress, exercise. keeping your weight down. Definitely ladies who are carrying more weight do struggle more with the hot flushes and the sweats. There's no doubt about that. I think it's important to say that HRT is safe and effective for most women, okay? And there are hormonal ways to manage the menopause and non-hormonal ways to manage the menopause. The hormonal are probably more, not probably, the hormonal methods are more effective. And there's lots of ways of delivering HRT these days: tablets, gels, sprays, patches. The Mirena coil can form the progestogen component of your HRT. For women with a womb, where your uterus is still in, you need estrogen and progestogen. If you've had a hysterectomy, you only need estrogen. And yeah, testosterone, not very commonly used in primary care. Some specialists and some GPs will prescribe it for libido, but my advice would be to optimize the estrogen replacement before you start thinking of adding in the male hormone. So it is safe and effective for most women. As I said, the pendulum has swung. Whenever I first qualified as a GP, like very few HRT prescriptions were done. Now there's a lot more done. It's good that there's more awareness, of course, but every case does need to be assessed individually, and we've had the Davina effect, which you maybe all know of, where the HRT prescribing just went absolute, or the requests for HRT, I don't want to use the word demand, but the requests for HRT went through the roof. And it's not the magic bullet. It's great for women who need it. The younger women who are just coming into the menopause probably benefit the most, and it is most beneficial for flushes and sweats. So if there's a symptom that you're really targeting, that's the one that you will see the difference with. If you're only using HRT for more of the brain fog, cognitive type stuff, you'll see a bit less benefit than if you have a 51-year-old lady who's in and the sweat and the flushes. She will really benefit from HRT. So, yeah, a wee bit about the risks. I'm not going to go through all of that. The risk for your breast cancer is actually, for the first 5 years, if you're using a bioidentical formulation, then the risk is not much higher. Your biggest risk factor for breast cancer, because there's a background risk, which is the one, the ladies along the top. See the really, really long line? That's an additional 24 cases for women who are overweight or obese. So the weight, carrying too much weight, is definitely more of a risk factor than your combined HRT, which is the second row along the top. Yeah, so we've talked about a wee bit about the risks and the benefits of controlling the physical symptoms, bone density, and there's a small increased risk of breast cancer with combined, and a small increased risk of strokes and clots. The vaginal preparations are extremely safe, and they just target the local symptoms of vaginal dryness, irritation, and any ladies who are having recurrent urinary tract infection as you get older. Really important to think about vaginal estrogen, and it's not the magic bullet either, but it will definitely help, and it may reduce down the number of urinary tract infections actually that you get. Don't be afraid to go to your GP with your irritation and itch and so on down below. There definitely are things that can be done there to help.
Brilliant, brilliant, so helpful. Jen has touched on this, or no, Claire has touched on this, but Jen, could you tell us then just why perimenopause and menopause then does emotionally, why does it feel emotional for us and difficult as women?
I'm just going to play a clip because it really illustrates what Claire has just said. It's, again, a funny one.
I wish somebody told me what was headed in my way. I think I could have dealt with it better. Okay, there's a thing that's going to happen to y'all. In your late 30s, early 40s, it can start then, and it comes in the middle of the night, like a ghost. And it's called perimenopause. And nobody talks about it. And they should, because it lasts 10 years. And these boys that are my age, they've already been through this. Honey, they've laid in the bed next to a woman and thought, is that steam coming off of her? Why is she crying? Because Tanya didn't invite her to the Weight Watchers meeting. Her hormones are just like this, just a nut. Y'all's hormones will be similar to a middle school girl. Do you remember that, Hora? Okay, that's perimenopause. You'll know you're in it when all of a sudden you'll start sweating here and here at night, and you'll wake up and your hair will look like chicken fuzz.
I mean, it just illustrates, doesn't it, just exactly what Claire's just said. You know, and perimenopause, menopause, it is usually explained in biological symptom terms, and rightly so, because they're so real. But usually when people come to see me, what they say is, I just don't feel like myself anymore. And that's sort of where the emotional sort of journey starts. And it arrives, as Claire said, usually at a time when, you know, lives are so full. We're full to capacity. We're managing challenges, careers, children, maybe looking after older parents or family members. It's insane, isn't it? And usually carrying the load for everyone else as well. So internally, something is shifting, but externally, nothing really is being asked any less of us. And that really does create a bit of what we would call cognitive dissonance, or basically anxiety. So that's why I think a lot of times it is described a bit like a crisis, because it can feel like that, especially for women who've been really capable and who've been relied on, you know, for years, just suddenly starting to question, you know, I can't keep doing this in the same way anymore, and who am I now? I think it's across the board we start to question, and that's, you know, it's not just in one area. So in our relationships, we might think, well, why am I always the one checking in? You know, what happens if I stop organising everything? And in work, maybe we've realised, you know, what unofficial job titles we've held for the past 20 years, you know, always being the fixer or the organiser or the person who knows where everything is, or the peacekeeper in a meeting, or, oh, well, if you want it done properly, well, it's you know, give that to her. And even at home, I just think, you know, it's the last end of the day, you sitting down with a cuppa and the phone rings, or someone says, Mom, you know, your whole nervous system can just go, no. And I think, you know, women, you know, begin, I think, to notice they've just start to have a bit more awareness of maybe repeating patterns that have existed, maybe things that they're not even consciously aware of, the people-pleasing, the over-functioning, the saying yes to everything just automatically, and kind of ignoring their own needs. So I think, you know, it's not, you know, there's a focus on what actually matters, because it isn't really about, I don't think in this season anyway, becoming someone different. It's almost like returning to yourself, you know, saying what you actually think, paying attention to what you actually need, recognizing you have needs, resting without feeling that you've had to earn it, and that it's okay to have a break, and just no longer sacrificing everything just to keep the peace, or just to feel like you're keeping everything running. And I think Brené Brown said it. She's an American research psychologist. She's just fab. She said, midlife is not a crisis. It's an unraveling, a time to let go of who we thought we were supposed to be. And I think that's lovely, because it's not a loss of our identity. It's actually a sort of transformation of becoming a more honest, grounded, authentic version of who we actually are.
Puts a lovely slant on it, doesn't it? It really does. It doesn't have to be as scary as sometimes it comes across. Sure, it doesn't. Claire, could you briefly tell us then about bone health and osteoporosis? So how would we know we have it, or how do we prevent it occurring?
All right, this is a personal favourite of mine. I have a real interest in bone health. Osteoporosis doesn't have any symptoms. I think that's the key thing. And I have a lot of ladies who'll come to me and say, I have back pain, could I have osteoporosis? It's a really interesting question, because the answer is, we'll know that the osteoporosis per se doesn't cause the back pain. However, what osteoporosis can cause is fractures, which causes pain. And it's really a disease characterised by loss of bone mass, and a susceptibility then to fractures. And a fragility fracture typically is one which happens when you fall from a standing height. So it's a low impact fracture, and the most common sites for osteoporotic fractures are the wrist, the neck of humerus, so the top of the arm here near the shoulder, the hip, and vertebral fractures. So most of them happen with a fall and an injury resulting in the fracture. Vertebral fractures are a wee bit different, and they can happen just with normal activities like bending over, and they seem to be a bit more spontaneous, and they're also probably more relevant then and important to think about. So if you're an older lady and you've just bent over and you have sudden pain mainly in the thoracic area, so that's the area from the base of the neck down really to the curvature or the bottom of your rib cage, that's the thorax. And thoracic vertebral fractures are really a feature of probable osteoporosis or something wrong. Often the first presentation is a fracture. And it's a frightening statistic, more than 1 in 3 women and 1 in 5 men will sustain 1 or more osteoporotic fractures in their lifetime. So it's a huge public health issue, and there's lots of risk factors for it. Ladies, of course, female gender, age, being postmenopausal, having a very low BMI, which can be reflective of either a malabsorption type state, so for example, celiac disease, Crohn's, more at risk of osteoporosis, but maybe just poor nutrition, eating disorders, people whose BMI has been really under 19 for their whole life. Smoking, alcohol misuse are big risk factors for osteoporosis, and family history is important, so that would be part of one of our screening questions. Did your mum or dad ever fracture their neck, a femur, their hip? And certain health conditions, rheumatoid arthritis. We tend to be pretty good at screening for osteoporosis in some of these groups, and certain medications, so steroids, and some of the treatments that are used for breast cancer. Reducing risk. Here's the big one for me as a parent and a parent of teenage girls. Optimizing bone health in childhood and adolescence is so important and so overlooked. So you will develop bone density, increase bone mass up until your age 25, and then after that it starts to fall off. So a lot of people assume that once they're grown, that's it, but they've actually got another number of years to go where you can get to peak bone density. So good calcium and vitamin D intake and good exercise, weight-bearing exercise at all stages of life is absolutely vital. We should all be taking a vitamin D supplement, no matter who we are. That's recommended across the UK, so 10 micrograms a day. Our kids love the little chewable ones that you can get in Home Bargains. Like, they're very, very cheap, and recommend that. We talked about falls reduction. Exercise again, anything muscle strengthening, weight-bearing exercise to really try and build that bone architecture. Management of it can be managed. Actually, there's really good management for it. Calcium and vitamin D, DEXA scans, those are the scans that we do to check for bone density. And then there's a group of drugs called the bisphosphonates, which are, if your risk is, there's lots of calculations that we do and risk scores and so on to try and establish who needs these medications, but the bisphosphonates, and then HRT for the younger woman. So if you have early menopause is really under 45, premature menopause is under the age of 40. Anybody who has premature menopause does need to be investigated by secondary care, but anybody with early menopause, so if I have a woman in her early 40s who's clearly going through the menopause, I will be thinking along the lines of HRT for her, because of her bones, as well as to manage the symptoms. So yeah, it's an emerging interest area, and it's important. It's not always thought of. We're really good at talking about cholesterol and blood pressures and diabetes and things like that, but I think we need to be talking about bones too.
So important, isn't it? You don't get multiple versions of your bones. You get what you get, so we really do need to protect those, don't we? Jen, I know we've talked quite a lot about this already, so no pressure, but are there some strategies that we can do today to improve our mental health that maybe we haven't already looked over?
Yeah, I think improving our mental health doesn't usually have to involve a whole dramatic life overhaul. I think it is about doing the small things consistently, daily, over time. I've seen sort of, they probably have the most huge benefits, actually. I think one of the first things is to prioritize our self-care. I don't think self-care is indulgent. It's really essential. It's almost like, psychological oxygen. And I've heard people say self-care is healthcare. It's a bit cheesy, but actually, it just shows how important it actually is. And it's not just physical healthcare. Self-care is about how we talk to ourselves internally. And invite just, internally to ask yourself this question, what's the harshest thing you've said to yourself recently? And it might have even been this morning. We all do it. And would you say that to someone else? Would you say that to someone that you actually love? 9 times out of 10, we wouldn't. So what I would say is when we get those thoughts is a really good way to sort of look at them is just ask yourself, is that thought kind? Is it true? And actually, is it useful? So the second strategy I would really recommend is to go a little bit further than that. And what I would call practice fierce compassion. So that means going a little bit further. So it's an action attached to it. So it's more than just being kind. It's what are you going to do about it? And usually it is about healthy boundaries, which we've talked a little bit about. But that does mean saying no, which can feel really uncomfortable. It can feel, I don't know, like you feel really guilty and, terrible. But actually that discomfort, I think we need to do it in order to sort of care in a sustainable way. Because I do see boundaries as compassion in action. They're just looking after our own mental health at the same time as caring for somebody else. It's that friend or that family member who you really dread meeting. You've got to psych yourself up. Or you feel totally drained, after seeing. It's like, how do we boundary and ring fence off those relationships? How do we protect ourselves within it? Whether that is reducing our accessibility, having a time frame around it, but just being really mindful. Now, I wanted to show you a brief clip of an example of what happens whenever we don't set healthy boundaries, what this looks like.
Well, I can't deny I am totally available for Christmas lunch, so I'd be delighted to accept.
A result! Oh, so you will come then?
Yes. I'd love to come and taste your stuffing.
Splendid.
Well, I'll see you at the service, and lunch will be about 1 o'clock.
What?
I mean, usually it's just me, my sister, and my mum, but this year I said, can I bring the vicar along? And Mum said, oh, the vicar won't come. She'll have far more important people to have lunch with.
It's funny you should say that.
And I started to cry, and I said, no, she won't, because I'm her best friend in the universe.
A couple of slices of turkey and a few veg for me, thanks.
Absolutely.
How many types of vegetable is that?
16.
Meat and 16 veg. That's always been the way in Dibley.
Tucking, Vicar, there's more where that came from.
Lucky me, eh? Well, that was scrumptious. Thank you very much indeed. Well, perhaps I'll just have a small portion. Original. Not going for the traditional turkey, then?
Well, not as a starter, no.
Right. You do it very well.
No, I'm fine. It's just I'm, a little bit sort of... to go now. I've got a taxi waiting. Maybe I'll skip supper tonight.
you get the picture. But what I wanted to say is boundaries, having boundaries still allows us to care for others, but also ourselves. We don't have to abandon ourselves or our own needs whilst we can still care. The third one is a really good strategy, I would say, is try, if you can, and externalize really difficult thoughts or emotions. Journaling, I think, is a really powerful one. I know a lot of people who do sort of very brief gratitude journals. Also, I think it is, in therapy, maybe ask someone to write a compassionate letter to their childhood self, or perhaps write a letter to their future self, or even write a letter that they don't send, to deal with really difficult emotions like anger, frustration, disappointment, that they can't express to the person. So they don't send it, so they might destroy it or some kind of symbolic way of getting rid of it. But it sort of externalizes it out of themselves onto a page. And again, you can sort of see it in a slightly different way. So again, we're just trying to look at, difficult emotions slightly differently. Another tactic or strategy, I suppose, is using mental imagery. And I'd use leaves on a stream, which you might have heard. It's essentially imagining yourself on a riverbank, watching your thoughts just go past on leaves. So it kind of gives the notion of we have a myriad of different thoughts every day, every hour, every minute. And some of them we don't need to act. We can just non-judgmentally observe them and watch them go past. So that can be quite a calming idea, notion that, another thought will come along in a minute anyway. And another good tactic around externalization is giving emotions a name. I have a client who calls their anxiety Dave. And so we would literally go, oh, well, Dave showed up again. Or Winston Churchill called his depression his black dog. So, it would sit with him, sleep with him on the bed. So it's a lovely kind of metaphor to talk about whatever it is, mental health difficulty that you're suffering with, that it's not inside you. It can become a bit more manageable. And again, lastly, I would say strengthen connection. I just think about the last time you had a really meaningful conversation with someone who really understood you and listened to you, and how powerful was that? Not just psychologically, but biologically. It helps us feel calm. And I do think we need to surround ourselves with really positive mirrors. The people who reflect back our strengths and our value and our worth when we find it really difficult to see those ourselves. So I think, in essence, it just begins with the really small daily actions, but they build into something really powerful: self-trust, resilience, and emotional well-being. And ultimately, it is about, extending to ourselves the same care and love that we would extend to other people. I think it starts there.
So good. Thank you. My daughter decided to call her anxiety a name she does not like a person she doesn't like, because then she will go, I don't have to listen to them. I'm like, that's a great idea. So we have just two questions left, but we're a bit pushed on time, but they're both valuable. So we're going home today and we're going to love ourselves better, right? And we're going to get a support network in place so that we can have people around us to point things out, right? And we're going to challenge our GPs because Claire said we could, right? We're going to do all of those things because they're really important for us, for our mental health and our physical health, yes. But if we go home today, what are the symptoms that we definitely shouldn't ignore? What should we beat our GP's door down for? Clicker.
I think this can be summed up with blood that shouldn't be anywhere and lumps that shouldn't be anywhere. So bleeding after the menopause, bleeding after intercourse, bleeding in stools, bleeding in sputum, so those sorts of things. Weight loss, unexplained weight loss, particularly with night sweats. Night sweats obviously very common in the perimenopause, but if you're not in that age bracket and you don't have any other symptoms of the menopause and you're losing weight, please do not put them down to menopause. I think we're all pretty aware that breast lumps need to be checked out. Even if you're a young woman, breast lumps will all be checked out. Will be referred to the breast clinic for a full assessment. A difficulty swallowing, so food sticking in your esophagus or increasing heartburn. Blood in your urine, of course, as well. Poor appetite, that's not normal, all right? Most of us have a good appetite. So if for some reason or other you're eating very small amounts and feeling full very quickly, that's something that's worthwhile checking out as well. And those are all sort of cancer-related symptoms, red flags that we would talk about. But there are other things, any sort of persisting severe pain, particularly at night time, unremitting, we talk about unremitting severe pain is worth getting checked as well. But things like chest pain, shortness of breath, those things should obviously not be ignored either. And there are lots of health things that shouldn't be ignored. And maybe reframe a little bit. GPs do want to work with you in partnership, okay, but they are very, very, they are the most misunderstood part of our workforce, in my opinion. It is the most misunderstood job. They're not trying to work against you. They are struggling massively with all of the issues which you are in terms of access. We are all patients in this system, me included, all of the doctors included. We're all trying to access services. I'm no different on the phone at 8:30 if I need to speak to a GP about my child, about some particular issue. So remember that, the media will try and make us public enemy number one. We're not public enemy number one. We're really trying to do our best in very difficult circumstances. We're try and work in partnership and accept that the access difficulties are there for all of us, and they are bigger political issues and not interrelational issues. Okay, so if that's helpful as well.
Yeah, no, that's absolutely brilliant. So the last question is the same question to you both, but Jen, if you would go first. So, clicker. Our last question then, how can a Christian woman learn to accept and navigate the mental and physical challenges and changes that come with aging, but stay grounded in her faith at the same time?
Well, I actually think aging is really misunderstood. I don't think it's only about decline. I think there's a duality to it. If we all think about, what God has been growing in us, the patience maybe we didn't have before, or the faith that has been strengthened through difficult times or seasons, or it's what we know now that we didn't 10 years ago, and I think that actually really matters. The first thing I'd say is to try and stay rooted in what doesn't change, because obviously I think one of the biggest challenges is that women, learn to build our identities on our appearances or how productive we are, what we do for a job, or what roles we have in our families. But they're all things, I think, that change. Energy changes, our health declines, our children grow up and move on, we might retire, so I think it's really important, just psychologically, if you only attach to external things, that can feel quite frightening, I think, because it can feel like you're losing parts of yourself. But faith reminds us that our identity is rooted in God. So while things around us, life changes, God doesn't. So I think that's so reassuring. Secondly, I just think be honest about the losses. Because it does come with aging. There are real losses of people that we've loved, or things that maybe we've wanted but just haven't got, the loss of what might have been. And I think we need to give ourselves permission just to feel those without any shame. I don't think grief is a failure of faith. You don't have to pretend we're okay. Actually, God already knows our hearts. And we can come to Him with our fears and doubts and tears, knowing, that He will meet us there. I think personally, for me, sometimes the greatest growth in my faith has happened, when life hasn't been easy. And I've just clung, to Him like a child, almost. I think thirdly, I know I can't get emotional, it's terrible. I'm terrible. Thirdly, having a sense of purpose. I think I recently watched a program on blue zones which I didn't know anything about, but blue zones are places where people live the longest and the healthiest. And one of the common themes was knowing that your life still mattered and that you will have something to contribute. You still do. And I think that's deeply relevant for Christian women. You know, as we get older, our purpose doesn't, deplete. I think we're needed more strategically. You know, we can mentor younger women, offer practical support for people who are struggling. We can help others grow in their faith by sharing God's word, offering encouragement, and just basically as living examples of his love and fulfillment. And I think that is why the church really is so important. We need people who remind us who we are whenever we forget. People who can pray with us in difficulty, and people who can carry hope for us whenever we're a bit tired. And I think that's part of life in God's family. We're actually meant to be known, supported, and strengthened together. So ultimately, I think aging is quite profound. I think of it as moving from striving to abiding. So striving says, well, I have to hold everything together. I have to prove my worth. I have to be everything to everyone. Whereas abiding says, I'm already held. I'm already known. You know, I'm already enough in God. And I think, it means you stop trying to earn, I think, what's already been given. Because I think there's moments in life when we all feel like we're barely holding things together, but the deep truth is that we're already held. The eternal God is your refuge, and underneath are the everlasting arms. Sorry, I get emotional, I'm so bad. But we need to walk forward with confidence, not because we have any of the answers, let's be honest, but because we're held, by the one who does. And I think his everlasting arms remain beneath us, and there's a real, I think, peace and rest that comes with knowing that we can abide in him. Yeah.
No, that's brilliant. Gosh, how do you follow that? It's just so wonderful. Thank you so much, Jen, for sharing that. I had a few wee things, I have no slides for this, but let's remind ourselves that aging is a privilege not afforded everyone. We're so blessed every year that we have. We're so blessed to be here. I also think that no matter what season of life we navigate, no matter what health difficulty we navigate, holding on to the truths and the promises of Scripture and standing firm in those and searching for them and reading them and speaking them to ourselves again and again through every season. And remembering that our worth is not in how we look or how the world values or how the world sees us, but our identity, if we are children of the King, is as daughters of the King, and that's where our identity lies, and that is where our worth lies, and not in what society says. And I wanted to remind us of really well-known verses that you will maybe know in 2 Corinthians 4, verse 16 to 18, and it says, "Therefore we do not lose heart. Though outwardly we are wasting away, yet inwardly we are being renewed day by day. For our light and momentary troubles are achieving for us an eternal glory that far outweighs them all. So we fix our eyes not on what is seen, but on what is unseen. Since what is seen is temporary, and what is unseen is eternal." And I know that was probably written in terms of the church that would be persecuted, physically probably persecuted, but we, whilst we hold the responsibility to steward our health well, and I'm a big advocate of that we have been gifted with bodies and abilities, it is our responsibility to steward those well for ourselves, for our society, for the benefit of the NHS, for our families. Whilst we steward that well, we accept the fact that our bodies will fail, and these bodies are not eternal. And so our hearts and our emphasis in life should be looking forward to an eternity with Jesus and an eternity with him, if we know and we love him and we follow him, knowing that there is beyond these bodies eternal hope, and the promise of eternal life with him if we've given our hearts and our lives to him and if we're following him. So stewarding and responsibility, however, also grace grace for these bodies where I know women carry so much. It's very complex why the lifestyle things that I've mentioned today are often very difficult to implement, and there's grace for that. And there's grace in our weakness. And remember the Apostle Paul, who had a thorn in the flesh, and your thorn in the flesh may be those arthritic hands or feet, or that prolapse that you're dealing with, or that knee pain that you're dealing with, and you're battling with the NHS waiting times and so on to get something sorted. But that there is grace for us, and that his grace is sufficient for us in our weakness. And my mum is a great example of that. My mum's 71. She had us young. And I was just sharing with some of the girls earlier that she is, at her age and stage of life, is serving. Her best years are now. Her best years, she is serving in her local church. She manages to feed half the church, with bakes and whatever else. She looks after us. She's got 4 daughters. She makes dinner for each family one night during the week. She looks after my kids one day a week. She is a constant source of strength for us, and she is a trophy of grace in the kingdom of God. So your best years are not behind you. So that's what I would say.
It's brilliant. So good. That is all of our questions wrapped up. Could we please thank these incredible founts of knowledge on this stage, please? Thank you. Thank you both. That was a whole wealth of knowledge for us to take home. Charmaine is just going to share with us for the next 5 or so minutes, and then we will head home. Just before Charmaine starts, I do want to say that neither of these ladies, obviously with the nuances in the room and the amount of specialised information that would be needed for specific medical health, neither of these ladies can have those conversations with you today for obvious reasons. Firstly, there's too many of us, and secondly, just your situation would probably come with a lot of history. So please, maybe don't ask them specific private questions today and put them in the position of having to apologise. Please see your GP, please see a mental health expert. But if it's just support you need, come and find one of us. We're in, but I'm sure they would love to say hello and just maybe get to know some of you just better in a different way. But we really appreciate you coming this morning. So Charmaine.
Okay, thank you so much, Shelley. Thank you, ladies, so much. I don't know about you, but I so enjoyed it. What a great way to spend a Saturday morning. So my name is Charmaine, in case some of you don't know me. And I am just going to bring this morning to a close, and I promise I will not keep you very long. And it's just doing this on behalf of our Empower team. Nick here at the front, I would just really like to honour Nick this morning, because this was her idea, and she has just led us so beautifully in the last what have we been planning this, 6 months? Would that be fair to say? So could we just give Nick a hand, and just the Empower team as well, just for what they have laid on for us this morning. And I just want to bring this to a close and really tell you a wee bit about why we did this morning. What is our why? And before that, again, I want to echo and say a sincere thank you to Jen and Claire, for travelling from Wales and Portadown, respectively. Thank you for giving up your time to join us today, and the benefit of your expertise and your knowledge, your wisdom, and your heart as well. It wasn't just words, and it's so greatly appreciated. And I know today I feel better informed. I have to say I love words, and my favourite phrases from this morning were chicken fuzz. I really loved that, and bone architecture. That is beautiful. So 2 very different things there, so thank you. Could we just give them a clap again? Thank you so much. I also want to thank the team that worked behind the scenes. Luke up here, don't want to embarrass him, but I'm going to. Thank you, Luke, for giving up your Saturday morning. Thank you, Luke, for the slides, everything. And thank you. There's some men out there, and they're clearing up as well, and we just want to honour and thank them. So just 2 to 3 minutes of your time, I just want to tell you why we did this, and then I'll let you go, because Saturdays are precious and we all have things to do today, okay? So as Nick said earlier, we've prayed, we've planned, we've prepared to welcome you And before we leave, we just want to share why. Why did we do this? And to do this, I just want to tell you a little 30-second story. So the other night, I turned my living room into a spa retreat. I closed the curtains, I lit a candle, and I invited my little girl, Olivia, who is 8 years old, to lie down on a towel on my sofa and have a full spa experience. Armed with Vaseline, body lotions, various questionable products from Home Bargains, including a very strong foot mask, and even cucumber slices from a cucumber that I think was in my fridge for a couple of weeks, but she didn't know that. If you cut off the end, it looks as fresh, just a wee tip. So yes, I give her the works from head to toe, immersing myself in a role play with her, which she absolutely loved. And my thing was that my purpose wasn't just to pamper her. After all, she's only 8. And a spa isn't something that we would say an 8-year-old needs. However, it was to help her relax. It was to create a space for her that she might share what was on her mind and heart with me, to make her feel secure, to make her feel safe, to give her my undivided attention in what I know has been a crazy week for us as a family. Yeah, so as I reflected on this afterwards and was preparing what I would say today, I was reminded that this is so often the heart of Jesus towards us. He invites us into a place of rest, of safety, and of care. He meets us where we are, and he creates a space for us to bring our worries, our questions, our burdens to him. He meets us physically, he meets us emotionally, he meets us mentally. And it would be wrong of us for letting you go today without saying he will meet you spiritually as well. And so that is really why we put this morning on. We wanted to create a welcoming space where you could feel comfortable, you could feel cared for, you could feel supported without an agenda, while also offering practical help for you and encouragement for your health and your well-being. Whether you've belonged to this church for 40 years or you've just walked in for the first time today, I hope that you felt wanted, seen, known, loved. You are always invited here, and we truly hope that today has been helpful and that you will leave knowing that you matter, but most importantly, you matter to God. So please let us know. Shelley has already referred to that. If we can help you in any way, not just spiritually, but prayerfully and practically, we want to serve you. We want to help you. That is why we put this morning on without an agenda. Before we close, I just want to pray with us, and to do that, I'm not going to use my words. I'm going to use the words of a psalm that when we were praying here on Monday night, we prayed over you. It is a beautiful psalm, and it perfectly describes more than I ever could how much God loves you. So I'm going to pray this over us, and then we will go, okay? O Lord, you have examined my heart, and you know everything about me. You know when I sit down or stand up, and you know my thoughts even when I'm far away. You see me when I travel and when I rest at home. You know everything that I do. You know what I am going to say even before I say it, Lord. You go before me and you follow me. You place your hand of blessing on my head. Such knowledge is too wonderful for me, too great for me to understand. I can never escape from your spirit. I can never get away from your presence. If I go up to heaven, you are there. If I go down to the grave, you are there. If I ride the wings of the morning, if I dwell by the farthest oceans, even there your hand will guide me, and your strength will support me. I could ask the darkness to hide me, and the light around me to become night. But even in darkness, I cannot hide from you. To you the night shines as bright as day. Darkness and light are the same to you. You made all the delicate inner parts of my body and knit me together in my mother's womb. Thank you for making me so wonderfully complex. Your workmanship is marvelous, how well I know it. You watched me as I was being formed in utter seclusion, as I was woven together in the dark of the womb. You saw me before I was born. Every day of my life was recorded in your book. Every moment was laid out before a single day had passed. How precious are your thoughts about me, O God? They cannot be numbered. I can't even count them. They outnumber the grains of sand. And when I wake up, you are still with me. Lord, I pray for every woman here today. I pray, Father God, that they will have had meaningful and practical help. But Lord, more than that, I pray that today they will have found a place of safety, a morning from which, Lord, Saturdays can be so busy, a morning of stillness, a morning of companionship, maybe a new friend. Father God, I pray that they will have felt fed, watered, and needs met today. Lord, bless every single beautiful woman, beautifully made, wonderfully made, and loved. Let us walk out of here today knowing that you have been here. May there be no doubt that you were here. Lord, we thank you for today. We thank you for the resources. We thank you, Lord Jesus, for your presence. In your beautiful name, we ask it. Amen. Thank you again. Thank you so much. Yes, give everybody a clap.